Hi guys, so we are going to talk to you about executive function intervention. So you all probably have an idea of what executive function is, but just a reminder, it comes from the frontal lobe of the brain, and it's a set of skills that includes things like memory, emotion, regulation, attention, that help you make decisions and function in everyday life. And as we were doing the research, we decided to break it up into kind of three categories. So we found articles on specific executive function programs, um, motor interventions or physical activity interventions, and technology.
So each of our interventions we think are a lower level of evidence because although there was a large number of articles on executive function interventions, there were very specific implementation guidelines with small sample sizes. So it was less generalizable to the larger population, but this is still helpful information for a therapist to gain understanding and aid in treatment planning. So the first program intervention is social skills in the social competence intervention program. So there were male adolescents with high functioning autism. The intervention was delivered over a 10-week period, 2 times a week for an hour. This strategies were in a scaffolding way, so new units were built onto previous ones. And the maintenance of skills is reinforced through the use of repetition, integration, and feedback. And the units utilize didactic instruction, behavior modeling, rehearsal, and in vivo practice with other participants. And in vivo practice is when individuals participate in activities where they gradually approach situations and feelings that they're avoiding normally, and the results showed improvements in executive functions associated with participation in the SCI program, especially in the spatial working memory. Um, and the outcomes to find these results were used with behavioral tests such as the digit span and the spatial span subtests. And the level of evidence was a level 3, which was a controlled clinical trial.
So the second program intervention that we found was evaluating the efficacy of a training program that was used to promote executive function in 5-year-old children within like an educational or school setting. There was approximately 90 children, and it consisted of small group training sessions where they implemented activities that require inhibitory control, working memory, and cognitive flexibility, which are all areas of executive function. And the sessions were performed 3 times a week for 30 minutes. The children had to do specific tasks such as delaying or waiting to open a gift, a matching task, and a go, no go task. So you can see how those all relate to inhibition, working memory, and cognitive flexibility. There was positive results in these 3 targeted areas. They performed better in post assessments. And so there is correlation to school readiness and academic performance. And there is that support for group play-based activities in a school setting. That hands-on is really important for executive function. And it was a level 3 level of evidence with the group pre and post studies.
So the next area is a physical activity intervention, which was done to investigate the effect of chronic physical activity, also known as PA interventions, on executive functions in children. So the intervention included PA interventions such as exercise, active games, sports programs, and other child-oriented PA modalities. And the duration lasted between 4 to 16 weeks for 15 to 60 minutes. And the number of sessions ranged from 1 time a week to 10 times per week. And some of the PA interventions were PA only. So this included walking, running, jumping, and more automatic behaviors. And some included PA plus cognitive challenges that require greater cognitive engagement. And it was found that chronic PA interventions have a small positive effect on executive functions. And this was seen mostly when combined with cognitive challenges. But although only PA plus cognitive challenge interventions had a positive effect in this study compared to just PA only, this needs to be further assessed because there was not a large scale of randomized controlled trials. And the effect of chronic PA interventions was not greatly impacted by intervention duration, session length, and frequency. And this was a level 1 quantitative meta-analysis.
So I found the second physical activity intervention article. So it was a specific motor intervention that looked at motor skills on how it relates to executive function in school-age children with learning disabilities. So this study was with 7-year-old male elementary school students, and it was composed of sequential exercise-based stations, which focused on attention, balance, and coordination, which are obviously motor aspects. It incorporated bilateral, unilateral, and crossing midline approaches, and they focused on these activities that were also meaningful and purposeful. So they did find that sustained attention, working memory, problem solving, and planning were all significantly impacted by the motor intervention. So it is effective in building these executive function skills. And the movement and physical work is an important adjunct to education. So similar to Mackenzie's article, where you can't have just the physical activity or the motor, you have to combine it with education and instruction. And this was also a level 3 outcome research level of evidence.
So for the first technology intervention, I found a systematic review that looked at the effectiveness of restitution-based computer training programs to improve attention and working memory for stroke survivors with impairments related to executive function. So there were 3 types of computer programs: CogMed, QM, AIXTENT, and RehaCom, that each had like training modules that looked at, like, for example, the first one used visual spatial working memory tasks. AIXTENT looked at the 4 types of attention, and then I thought the RehaCom was very interesting and related to OT because the programs involved a lot of daily activities. Like I said, playing cards here, but there was another one that had the patient use a budget during shopping. And so results were mostly all positive. They used outcome measures that looked at attention working memory, and clients improved on most of those measures. And general auditory and visual memory were also improved. And it was a level 1 systematic review. And this next intervention focuses on LifeLog technology. So these are technologies that work to enhance autobiographical recall within rehab and improve error self-regulation and self-monitoring. So this study looked at this intervention combined with goal management training. I won't talk much about that, but there were 16 patients post-acquired brain injury. And so they used a SenseCam, which is a portable LifeLog camera that's worn around the neck, and images are captured when motion and light sensors are triggered. So that when the patients go to their appointments, they review these images and like kind of look back at the movie and identify trigger situations. So this is beneficial because they don't have to rely on self-report based information and memory retrieval, and the patient can learn to problem solve and self-assess their abilities. And then they used a Act-to-Heart system on them too, which just measured like level of physical activity. So results were very positive. The patient scored very well on, they had 2 cognitive tests, ZooMap and RSAT, and then there was also a qualitative aspect of it. So they found that they increased autonomy and quality of life. And then because of that self-monitoring aspect of identifying trigger situations, they improved problem solving and strengthened links between their rehab appointments into everyday life in their home environment. And it was a randomized clinical trial level 1. So summary of application for clinicians. So for the program intervention application, the use of repetition, integration, feedback, didactic, instruction, behavior modeling, rehearsal, and in vivo practice are beneficial in improving executive functioning with adolescents with autism. So it's based on CBT intervention and applied behavior analysis. And there's a correlation between implementing the EF programs and their child's school readiness. And it also just shows support for group play activities. For technology, clinicians can use these computer-based programs to complete real-life tasks involving these executive functioning skills. And then looking back at the images related to one's activity outside of the session environment can, like I said, help bridge the gap between occupational performance in rehab versus daily life. And clinicians can use PA interventions combined with cognitive challenges to improve EF, which reduces stress, depressive feelings, and improved sleep compared to PA-only interventions. And then play-based exercise stations with focus on attention, balance, and coordination are also supported, and the relationship between how motor physical activity and education impact executive functioning in children.
So for future study ideas, just overall, there needs to be more reliable studies so we can better generalize that intervention and those ideas. So a larger number of participants and increased diversity in demographics. A lot of the studies were male, like heavy, lots of just males in the studies instead of females, different ethnicities and socioeconomic statuses. And then obviously we want maybe more on the specific role of OT. So, and then again, specifically for the program intervention articles, studies that include both males and females, and just overall incorporating more participants. For the physical activity interventions, we want more that determine the effects of physical activity on older populations. A lot of what we found was for children and adolescents, and studies that include large-scale randomized controlled trials to determine if physical activity and cognitive challenge interventions have a stronger effect than just motor only interventions. So more can be done to look at that. And technology interventions, studies that focus on one specific aspect of executive function to avoid confounding variables, and studies that involve comprehensive sampling versus opportunistic sampling. And more can also be done in this area with children. A lot of the technology interventions were done with older adults. And there's our references.